Alright, hello, I am Dr. O'Gwen, and today we are going to demonstrate a technique called flexion distraction. This therapy is utilized to treat a variety of low back pain conditions, specifically arthritis, disc herniations and disc bulges, spinal stenosis, and some of the other more common causes of mechanical low back pain. This is also very effective in treating sciatica, which is when the patient has radiation of pain from the low back into the back of the hip and all the way down into the leg. When we do this, you will see that this is going to be a very gentle, non-force adjustment. It's very similar to decompression therapy in that we are going to distract the spine, decompress the discs. It opens up the spinal structures. The difference being that this is entirely hands-on, so I can control all of the movements at all time. I can isolate specific levels, and we can incorporate a larger variety of ranges of motion. So let's go ahead and demonstrate this. What we do is flex the pelvis forward here. You see this flexion. This starts to open this up. I can further get more distraction by putting some upward pressure on the spine. Again, I can specifically isolate the structures that we want to get. We can incorporate some side flexion and open those up even more. People who have the sciatica going down, say they had it going down the right leg, this is very effective in reducing the pressure on there. Decompresses the discs. It relieves the pressure and the irritation of those spinal nerves. This flexion distraction also creates a negative pressure within the disc, and it helps rehydrate the discs. So people who have disc degeneration, this works very well for. It opens up the spinal canal area. It relieves pressure from spinal stenosis. And the back of these joints here are called facet joints. Sometimes they get jammed, and this will open up those facet joints. And with many low back pain conditions, these spinal muscles that run right along the spine here get very tight. We can relieve that tension by placing pressure, and we flex and side flex. We're stretching those muscles out, and at the same time we're loosening them up, and this is a myofascial technique to reduce the tension in those muscles. Now this technique, along with the appropriate stretches and exercises, can effectively treat and eliminate the majority of low back pain conditions.